Welcome to the Improving Healthcare Together 2020-2030 listening event presentation. What we're about to explain to you are the proposals that have been set out in our consultation documentation. The consultation is currently running and will continue to run until the 1st of April. The presentation sets out the proposed case for change and clinical model. It also describes the options that are under consideration and some of the potential impacts that each of those options may have. We would be really keen for everybody that can respond to the consultation to either fill out a questionnaire or send us your comments to the Improving Health Together inbox. Thank you.
I'm Dr. Andrew Murray. I'm a local GP and I've been working in the area for the last 20 years. I've been therefore very aware of the issues that Epsom and St Helier have been facing over that period of time. Over the last couple of years, I've been working with local clinicians, so doctors, nurses and therapists from the communities that Epsom St Helier serve, and also with those clinicians working in the hospital themselves. We're really excited about this opportunity where we've got £500 million to invest in Epsom St Helier to improve the quality of care for our patients. 85% of services will remain on both the Epsom and St Helier sites. That's caring for 700,000 patients per year. Both sites will be open 24/7, 365 days a year. In addition, we will be building a specialist emergency care hospital to care for the very sickest of our patients. That hospital could be built either at Epsom or St Helier or Sutton, but our preferred option is Sutton. So first of all, let me tell you about why we need to make those changes, i.e. what are the issues that Epsom St Helier have been facing. Firstly, there is the issue of quality. Epsom St Helier have not been able to deliver the highest quality of care simply because they do not have enough consultants to meet clinical standards to make sure we have the right staffing levels of the most senior consultants on site all the time that we need them. There's a shortage of doctors across certain specialties and particularly in emergency medicine and critical care. We know we need to do something about that. We want the very best quality of care for our patients. The next issue to address is that of buildings. 90% of buildings on the St Helier site are older than the NHS itself. We do not believe that is acceptable for the 21st century. Some of our buildings are crumbling. On the St Helier site, when the lifts break down, people have to be taken from one part of the site to another in an ambulance. At Epsom, sometimes patients have to be wheeled out in the rain. We do not believe that's sustainable. We want to do something about it, and we really have an opportunity to do that as part of the proposals that we're working on. The third challenge is that of money. Currently, Epsom and St Helier hospitals are spending a lot of money on temporary staff. In addition, they're spending a lot of money on upkeeping and repairing old buildings. That's not efficient and it's not sustainable. We want to make the best use of public money, and creating new buildings that are fit for purpose will allow us to make much better use of money in a sustainable way. So as I set out at the start, 85% of services will remain on both the Epsom and St Helier sites. Those are what we call district hospital services. By that we mean outpatients, so where you go up to a clinic to see a specialist. We mean planned care, which is operations that don't require an overnight stay or critical care. Diagnostics, so X-ray, MRI scans, and a whole range of other services, including a number of beds for people who do not need critical care, so can be moved from the specialist emergency care hospital into beds where they can have proper rehabilitation delivered by a broad team of doctors, nurses and therapists to get them in the very best condition back home as quickly as possible. On both the Epsom and St Helier sites, we will have an urgent treatment centre which will be open 365 days a year, 24 hours a day. 2 out of 3 people who currently attend our A&E departments can be dealt with at an urgent treatment centre, and we will make sure that those units are fully staffed and available to the public. We will also make sure that everyone knows where they need to go with whatever condition they have. The second part of the proposal is the specialist emergency care hospital. and we will put all those specialist services together on one site. In the specialist emergency care hospital, we will bring together the most critically unwell patients and our team of experts to deliver the highest standard of care. The 6 core services that will be delivered on the specialist emergency care hospital site will be the major emergency department, acute medicine for people who need significant level of medical input, such as if you had a bad chest infection, emergency surgery, so those needing urgent operations, inpatient paediatrics, which means children's beds for those children who are so ill they have to stay in hospital overnight. All births will be delivered on the specialist emergency care hospital site when they have to be delivered in a hospital setting. That's so women who are in labour can have access to critical care when they need it, because critical care is the 6th core service that will be delivered on this site. The next slide simply gives you some examples of what sort of conditions can be seen on which site. So for example, if your son had fallen off his bike and had a swollen ankle, that could absolutely be dealt with in the urgent treatment centre. But if your child was poorly and needed to stay in hospital overnight, we would expect them to go into the specialist emergency care hospital, where they could have access to a team of paediatricians led by a consultant with access to critical care if they needed it.
My name is Sarah Blow. I'm one of the sponsors for the Improving Healthcare Together programme, and I'm going to tell you a little bit about the options that we have looked at. We have 3 options that we believe can be deliverable through this programme. They all involve keeping the district hospital services on both Epsom and St Helier sites. As you can see in the 3 options, the green hospital sites are the district hospitals. We also are looking at an emergency care specialist hospital. The emergency care specialist hospital is shown in blue and could be delivered on either Epsom, St Helier or the Sutton Hospital site. If we deliver the specialist emergency care hospital on the Sutton Hospital site, there will be an additional urgent treatment centre. So we will have 3 urgent treatment centres across South West London and Surrey. We used a number of criteria to assess our options. I'm not going to tell you about all of them, but as you can see from the slide, we looked at a number of different areas to check that we were doing the right things. Those included things like the quality of care that we will deliver and making sure that that is of the highest standard for our patients. We looked at the ability to be able to deliver the sites. So can the building be delivered in a way that makes sense? And we also looked at the finances to make sure that the money would add up. So we believe that all 3 options can be delivered by the NHS. But we believe that Sutton Hospital is the preferred option. And we believe that for a number of reasons. Firstly, because it's the least increase in travel overall for our populations. We also believe that it's the easiest to build. It's easier to build because it's on a new site with no current hospital. It's quite difficult to decant services from existing hospital services. It's also the best value for the taxpayer overall. We've done a lot of work on the finances. It means that we have the biggest catchment in the local area if we place this site in Sutton, and therefore there's more money coming into the local system, and overall it's the best value. So now I'm going to tell you a little bit about the analysis that we have done in order to make those decisions. Firstly, the bed analysis. We are going to have slightly more beds overall than we currently have. However, those beds may well be split between the sites or be in other parts of the system. All of the detail of this within our business case. It's very important that we get the bed analysis right, and we have done a lot of work on this, but we will continue to work as we build the business case going forwards. We've done a lot of work on travel analysis, and there's a full travel analysis in the business case. Overall, everyone will have to travel further depending on where we base the site, but overall the travel times increases are very small. Nearly everyone will be able to get to one of the sites in ambulance or car within 30 minutes. That's important because that's a clinical requirement. All options involve moving major acute services in some cases. However, as I've said earlier, the travel time increase is worthwhile because we believe the benefit clinically is overwhelmingly a good case for change. We have worked with all of the hospitals in South West London and Surrey to understand the impacts of any change to the specialist emergency care hospital. what we have found out is that all of the hospitals believe that all options are deliverable. However, they have a different impact depending on where we site the specialist emergency care hospital. You can understand that because if we sited it at Epsom, that would have a bigger impact on St George's, just as if we cited the hospital at St Helier, it would have a much bigger impact on Surrey and Sussex Trust. Therefore, it's important that we look at those impacts. So although they are all deliverable, there will be differential impacts on each of the hospitals, and we have built all of that into our business case.
Thank you for listening to our presentation. We want to know what you think. There are a whole range of questions in our consultation questionnaire that we'd like your views on. So please try and fill out the questionnaire online that's available on the Improving Healthcare Together website. And please do that before the 1st of April when the consultation closes. Have your say. Thanks for listening to us. Please tell us what you think.